one and all. Today, we have with us Dr. Prateek Shrivastav, Assistant Professor in Department of Physiotherapy from Mahe. Sir is a PhD from Mahe and he has various articles in his name in various peer-reviewed journals. He also has an n number of grants, copyrights and patents to his name. Sir is also an author in a in a book. It's an honor to have you, sir. Handing over the session to you, sir.
Thank you, Dr. Fareen. Hello, everyone. I'll be talking on the science behind recovery and how to maximize the performance and how to prevent the injuries among the athletes or the people on whom you are giving exercise. So we will be seeing how why recovery matters, the physiology of recovery. We'll be seeing the misconceptions about the recovery, and then we will be covering the key methods on how to do and the practical applications on the recovery. So coming first to the physiology of recovery, what does recovery do? So what happens is when we do exercise or when we take any muscular stress, the body recognizes exercise as a muscular stress. The body does not recognize that whether you are running on a treadmill or you are running otherwise, the body recognizes that we are running. So when we do exercise, especially with strength training, the muscles undergo micro tear. There will be micro tear happening with the eccentric contraction. The muscle fibers, the fibers which look like this, the muscle fibers will get torn. So there will be micro tears happening. So suppose I do strength training on a Monday, there will be micro tears that are happening. Then I do again the same exercise on a Wednesday, then again micro tear will be happening. So why recovery is important? The recovery allows the muscles to regain their protein synthesis. The protein which is a very essential component of the part of the muscles, the recovery allows the synthesis to happen. Plus, this micro tear, the body recognizes this micro tear as an inflammation. So the when we do exercise, all of you must have felt that once you lift heavy weight or if you're doing exercise for the first time, we feel some kind of soreness. That soreness is because of the inflammation, the micro tear that is happening in the muscles. So that is called as DOMS. Now what recovery does is when you let the muscles recover, then the DOMS will be taken care. The pain, the soreness in the muscles will be recovering faster. You will be recovering faster. And third thing that is most important is the when the body is in recovery phase, because of the protein synthesis and the fluid going out of the muscles and the eccentric contraction, during the recovery, the muscle strength improves. So the number of sacroplasm, the number of microfibrils, the components of the muscles will increase in size, as well as the number of the muscle fibers will increase. That is, one parent muscle fiber will divide into two daughter muscle fibers. So our muscle strength ultimately increase. So that is why recovery is very important in the first thing, that muscle repair and growth happens. Second thing is nervous system recovery happens. So when we exercise, the body goes into the flight or fight mechanism. So the sympathetic systems will get activated. Now, once you do stop the exercise, once you stop doing any activity where the sympathetic system gets stimulated, suppose you decide that you are going to run or you decide that you are going to do strength training, the body has to shift from sympathetic to parasympathetic, and it can become a little stressful for the nervous system as well. So the sympathetic this the rest what the rest allows or the recovery allows to do is it allows in smooth transition of the stimulation of the sympathetic system and the parasympathetic system. If you keep doing exercise, high intensity exercise daily, then the sympathetic systems get activated. And when the sympathetic system get activated, the body is always in a flight or fight mechanism. Now, because of this, there is the lot of hormones that are getting released and other problems. The body is always in a stressful condition, so that's why recovery is very important. So when you after your exercise or your exercise session, when you give rest, these hormonal levels start coming back to the normal, and the smooth transition can happen. So the third thing is hormonal regulation. So like I said, when the sympathetic system gets stimulated, the body releases stress hormone that is called as cortisol. So prolonged elevation of cortisol can lead to muscle breakdown and fatigue. So like when you are under stress, when you are not talking about exercise, but also when we are under stress, the cortisol's levels are always high. And after a stressful day, you feel more tired. You feel that you have done more work, but actually the cortisol's level were high. So that is what happens with exercise as well. So the cortisol's level will always go higher with exercise. So because if you are recovering, if you allow the recovery to happen, the cortisol's level can go back to their normal, and it also helps to restore the anabolic hormones. What happens is anabolic hormones like testosterone and growth hormones, they release more when we recover after then exercise. When you rest, when you recover, when you allow the body to recover, so the anabolic growth hormones, the anabolic hormones like I said, growth hormone and testosterone, these are very essential for muscle growth. These are very essential to adapt the system. So that's why it is very important. The last thing is energy system. So when we are exercising, we use energy. So what is this energy? We either use carbohydrate. So you are doing a quick burst of activity, you're using carbohydrate as a source of energy. Or if you are, suppose somebody is running a marathon, they are using fat as a source of energy. So recovery allows the body to replenish the energy systems. Now suppose today Monday, somebody does exercise, they have done high intensity exercise, or they did a sprint training, or they did strength training, the body will deplete the carbohydrate. Now if the person doesn't allow to recover, the body cannot replenish the carbohydrates. So that's why recovery is very important for replenishing the energy system as well, so that we can keep on working on Tuesdays, Wednesdays, Thursdays. And this recovery is very important for not only work, but our energy levels also will increase. So body's capacity to store the energy will be becoming much more higher. So this is the physiology of recovery. That's why recovery, that's what the recovery does to the body. Now what are the key methods of recovery? We can do recovery by active recovery and rest, nutritional and nutrition and recovery. Nutrition for recovery, we can rely on the food products for recovery, then hydration and recovery modalities. So coming to the first one, active recovery and rest. Active recovery is when you sleep, or when you are doing low intensity of activity, so that is called as active recovery. So when we do a low intensity of exercise, it helps in improving the circulation, regulating the hormones, and then also reduce the muscle stiffness. The active recoveries are very good for muscle flexibility. Next thing is sleep or rest. Consistent sleep of 7 to 8 hours and minimizing the blue light exposure can help regulate the melatonin. Melatonin is very important for our brain to function properly. If the studies have shown that if the person who does not sleep properly, the brain functioning starts reducing gradually. That's why rest is very important. Now this rest can vary based on your schedule and how a person has been exercising, whether it's a moderate to high intensity exercise. That can vary from person to person. Then nutrition for recovery. Nutrition again plays a very important role. The macronutrients play a very important role. What are the macronutrients? We have protein, carbohydrates, and fat. So protein are very, like I said, proteins are very important for muscle regeneration or muscle repair. So like I said that during recovery period, the muscle goes in regeneration. The protein synthesis starts happening, and protein is a very important component for the muscles to grow, because the muscles are made up of protein. They require protein. Usually, the regulation says that we should be eating around 1.6 to 2 kgs per 2 grams per kg of body weight of protein. Then carbohydrate are very essential. They are the basic components of glycolytic system. The glycogen is very much important for the endurance athletes. When the athletes are doing moderate intensity of exercise for a moderate time, that time glucose is very important. So it depends on what kind of sports or what kind of activity a person is doing. And usually 3 to 5 kgs per body weight, sorry, body, yeah, 3 to 5 grams per kg of body weight carbohydrate should be eaten. Next is fat. Now, when I say fat, I'm talking about the healthy fat, not the unhealthy fat. So this, what the fat does is, fat is very important for hormone production. So when the body, when a person fat levels deplete a lot, then even the insulin levels and other things may alter, and then it becomes very difficult for the body to regulate the hormones. So fat is, then good fat is very important for the body. So we have nuts, fish, olive oils, and other things. These are called as good fat. So that is how the body can recover through nutrition. Depending on what activity a person is doing, that kind of food the person should be eating. Then hydration. Post exercise, hydration is one thing which is very important. So what does the hydration do? It, first thing is, we all know that drinking good amount of water and hydrating themselves will prevent dehydration and muscle cramp. So dehydration, when the body depletes, when we are doing exercise, we sweat, depending on whether you are working in hot environment, cold environment, and then through our respiratory system we start losing water. Then the blood plasma in the body, that is the constituent of the blood, will start coming down. And because of that, what will happen is the heart rate increases, the cardiac output decreases, and that is bad. So the muscles require a blood supply to recover faster. That's why water, the hydration, the water drinking becomes very essential. Next thing is, uh, the drinking enough water after exercise will also help in nutrient absorption by the system. So the muscles can absorb nutrient much more better if you are hydrated, because the blood will be carrying the nutrients from the hormones and the food that we are eating, so the muscles can replenish faster. So that's why for performance, hydration becomes very important. Then there are various recovery modalities that are available. So what are the recovery modalities that are available? The first and the foremost is stretching and mobility exercises. So that's why the mobility exercises and the stretching should be done post exercises. This helps to maintain the flexibility as well as reduce the stiffness. So that is very important component. Then we have deep tissue massage, we have foam rolling. These are very important components of recovery that athlete, or as a physio, we should be concentrating for an athlete to recover better. So the foam rolling, massage, sports massage will help in breaking down the muscle adhesion as well as improving the circulation and reducing the soreness post exercise. So it helps in recovery much more better. Then cold therapy like ice baths, which is very popular. We have been, if you follow sports, you will be seeing. So what the athletes do is, especially after long a bout of exercise like marathon running or a test cricket, which goes on for 4 or 5 days, they dip themselves in the ice. This helps in reducing the inflammation, but we should be careful to prescribe it too much, because it may hinder in hypertrophy. Because why? Because when a person goes into the ice bath, the blood supply towards the muscle will decrease, and if the blood supply decreases, the muscle won't get the enough nutrients, so hypertrophy may get hindered. That's why people who require hypertrophy, like bodybuilders or weight trainers, who require athletes who require hypertrophy, should use it with caution. And as a physio, we should also advise them with caution. Then heat therapy, hot packs, sauna, steam baths. These are very much helpful in recovering because these will help in increasing the blood flow. This helps in promoting the relaxation, the muscles, the mind gets relaxed, and it also helps in muscle elasticity. So the flexibility will improve. So these are few recovery that that modalities can help. These are the key methods that an athlete can use, or as a physio we can use on athletes to help in reducing their soreness. Then this is a recovery. This is called as recovery pyramid. So recovery pyramids is, if you see at this pyramid, the topmost one is the myth, and the down ones are the ones which are essential. So if you see sleep and downtime, nothing can beat a good quality sleep. 7 to 8 hours of pure sleep, minimizing the screen time, and in a dark room, nothing can beat that. So that is very important. That not only helps for physical relaxation but also for mental relaxation. Then, like we discussed, nutrition and hydration is the next essential thing. Like I said in the previous PPT as well, depending on the type of activity that a person is doing, depending on the type of substrate, the energy consumed that the person athlete is using, they need to take nutrition and hydration. Then water immersion, the use of modalities, use of ice packs, use of compressions, active recovery pattern, that is stretching and massage that we discussed. That is very important. Then compression therapy is also used. Compression therapy is nothing but the person is asked to compress the area that they have exercised. The evidence is little less about this. The studies are still going on, but what they say is it helps in improving the circulation and reduces swelling, and may help in muscle recovery much more faster. But the evidence is less on that. Then there is minimum evidence on cryo chambers and EMS, electrical muscle stimulation and vibration. So the some studies say that they help, some studies say that they do not help. So the evidence is still little tricky on this. And then there are other methods that you must be seeing in YouTube. The so-called influencers will tell you that drink this, drink caffeine, or smoke, or do this. This will help you relax. But that there is no evidence for that, and these things are may hinder the performance rather than inducing relaxation. So we should, as a physio, as an exercise provider, be very careful on what kind of myth our athlete has picked up, and we should be having strong evidence on what we are going to use in the athlete, so that we can break their myths, and we can confidently tell them that what is wrong and what is right. So how to prevent injuries? So using these recovery methods, using this knowledge of physiology of recovery, and the methods on how to prevent the injuries. First thing, the first and the foremost thing that we should tell the athlete, or we ourselves, when we are exercising, we should take care, is listen to your body. The body tells you when to stop exercising and when it requires recovery. Your energy levels are going down, pain is there, your performance has decreased. That means your body is telling you stop, they need recovery. Then next thing is periodization. In next slide, I will talk in more in detail about periodization. So I'll leave it for that. Rest days are very important. So when we are strength training, or when we are prescribing strength training to an athlete, it is very important that we give 48 hours of rest between the muscle groups. So for example, if a person, we are prescribing exercise, or for ourselves we are doing exercise, suppose Monday I did exercise for the chest, I should be giving 2 days of gap to do the chest exercise again. This is very essential for the muscles to recover. The muscles require recovery. And again, high intensity of exercise is not prescribed should not be prescribed, and it is not recommended as well. The American College of Sports Medicine says that high intensity of exercise should not be done for more than 2 days in a week. An adequate gap should be given, it should be supervised, and then nutrition should be good enough. Then mobility exercise are very essential. A mobility exercise will help reduce stiffness, will induce physical and mental relaxation. Plus, they will prevent the injuries as well. So that is why it is important. Proper warm up and cool down. I'll not go into the detail. We all know why proper warm up and cool down is important. Prior to the exercise, we should be doing dynamic mobility exercises. You should be moving your limb much more, moving the limb. And post exercise, you should be targeting stretching. Stretching should be done to reduce the injuries, the chances of injury. Then avoid overtraining syndrome. So what is overtraining syndrome and periodization? Let's see in the next slide. So, what do we mean by periodization? Periodization is a hypothetical thing that is used in athletes or to prescribe exercise. As an exercise provider, we should be using this with proper knowledge, and it should be used when we are prescribing exercise or a training and any athlete or ourselves we are training. So, what is periodization? It is a hypothetical way of breaking down the time that we have for the event. So I'll explain this with a very simple example. The suppose we started training for an athlete in January, and the event is going to happen in December. So what we do is we break down the year into three ways through periodization. So what we do is, first thing is we say macro cycle. Then second thing is mesocycle, and the another one is microcycle. So what is macro cycle? We divide an year into months. So uh, if I have 1 year, I divide my 1 year into two macro cycles, 6 months and 6 months. My athlete is playing in December. The event is in December. So I divide the year into two macro cycles, that is 6 months plus 6 months. Then each 6 month is divided into mesocycle. Mesocycle will consist of, let's say that 1 6 month I'll divide into 2 3 months. So within 6 months I have three mesocycles, and then these 3 months will be divided into microcycle. So microcycle is, in that 3 months, we I will divide into 1 month, and that 1 month also I will divide in weeks. So this is how I am going to use this periodization for training my athlete, depending on what kind of sports the athlete is playing, or how what is the target, what you are targeting, what you are trying to gain from the athlete. Maybe agility, strength training. What is the level of athletes play? Suppose they are junior level, or they are playing state level, national level, or international level, or whether they are how is their fitness level. So whether they are a juvenile in fitness, that means they just started the game, or they are a pro, that means their fitness is good enough. So depending on that, you can vary within each cycle, you can vary the exercise. By the time December comes, by the time the event comes, my athlete should be ready. They should be within these cycle. There will be proper nutrition, proper recovery, and proper strength training or cardio training, whatever I am planning for the athlete. So this is how I break the periodization. So that is what is called as periodization. So this will vary from athlete to athlete, from sports to sports. That is that is how the periodization looks like. Now, next, coming to overtraining syndrome. What is overtraining syndrome? Overtraining syndrome is usually seen when like the name suggests, we overtrain something. So it usually is seen in over enthusiastic exercise providers or over enthusiastic athletes. So what happens is, when you do not provide enough recovery time for the muscles, you do not provide the muscles to replenish, you are not eating good nutrition, your diet is not good enough, the muscles, you are exercising the same muscles daily and you're not sleeping properly, plus you are taking uh, the ergolytic agents, that means the agents which reduce the performance like smoke, alcohol, or cigarettes, tobacco, then the body goes in overtraining. So what overtraining does, it reverses all the physiological adaptations that are seen with exercise, all the benefits that we may get with the exercise. So what it will do is it will cause mood swings. You will see that the person who is overtraining will have mood swings because it alters the dopamine and serotonin level of the person. The person will have irregular heartbeat, plus the heart rate will be elevated in the morning because the body is not getting enough rest and the body is under stress. So the body is always in a fight mechanism. So the sympathetic system is always stimulated. So the heart rate will be always higher. Then the person will find it difficult to focus, and because of that the pers- the athlete will be struggling with the training as well as the performance, because the muscles are not working properly. Now the muscles are tired, heart rate has increased, the athlete is always tired, so they will not be able to train and focus properly. Next thing is that will happen is there will be loss of appetite. So overtraining syndrome not only affects the muscles and the mood, it also affects the appetite. So because of that, the athlete goes in a cycle. They're not training properly, they're not resting properly, plus they're not getting nutrition as well. And there will be muscle soreness always because the inflammation in the muscles will be high. Like I said, lack of focus will be there. And because the cortisol levels are always high, the person's immunity will come down. The problem with cortisol level is being high is it reduces our immunity. It starts working on the innate immunity and the acquired immunity of the person, and the total immunity comes down. And because of that, frequent infections, frequent colds will happen, and that will be a problem. And the person will be always fatigued, always tired, because the cortisol levels have gone high, and the sleep issues will be there because the cortisol will interfere with the melatonin production, and because of that the person cannot sleep. So this is what is overtraining syndrome, and it's very dangerous. It can lead to it is seen that many especially at juvenile level, especially at the lower level, it finishes the career. The athlete cannot perform again at the same caliber again. So what is the take home message from this? Prioritize your sleep, have good nutrition, and proper hydration is important. Then active recovery, pay attention towards accurate active recovery and listen to your body. That is very important. Combine the modalities, whichever suits the timing, whichever suits the availability. So stretching, massage, hot and cold therapies based on your needs and based on your feasibility, and rest strategically to maximize the performance and the longevity in the uh, exercise for the athletes. So if now any questions are there, you can ask.
That was an indeed boggling session, sir. Though I have a couple of queries, sir. The first one is, if we have already identified a person or an athlete who is in that overtraining, how do we make sure that he comes back to an healthy training sessions?
Yeah, that's a very good question, Dr. Fareen. What we can do is first we need to analyze where the doses of exercise that is going wrong, where the athlete is doing more exercise. Second thing is the athlete will require psychological counseling, because first and the foremost thing, they need to be explained that they are overtraining. So and the heart rate and the focus should be back. So psychological counseling is very important. So we may have to refer to a psychologist. Third thing is we may have to work with a team dietitian or the nutritionist to work on their diet plan. And the most important thing that we should be doing is giving them adequate rest. Take them off the ground, take them off the training, tell them that do the things other than training which you enjoy. and then come back, let the inflammation in the body come down, and then take care of the training.
Rightfully said, sir. We'll definitely look out for these. Also, sir, once the recovery is completed, a lot of athletes do feel that lack of confidence. So, as a physiotherapist, what can be done for them?
After the recovery is done, you are saying?
Yes, sir. So,
Yeah.
once now the injury was there, we had a full rehabilitation, but once again, if they are back on the field, they have that slight lack of confidence which they experience.
Yes. Yes. So what we can do is usually what I try to do with the athletes is give them real life scenarios in a controlled environment. So before sending them to the sports ground or to their game, in the lab itself, make them do sports specific activities. So suppose they are runners or suppose they are strength involved in strength training, give them activities which are similar to their sports in the lab, and slowly do not throw them into the ground in into the competition immediately. Slowly induce them, slowly induct them in the ground. Let them play within, first let them play by themselves, then maybe with one teammate, then slowly keep on increasing their activities so that their skill levels are required much more higher. And always keep re-evaluating your athlete where if they are lacking, where they are lacking. So suppose maybe and during the recovery you have worked on the strength, but they may be lacking in the agility or the proprioception, so we need to work on that. So if we keep on increasing the activities like that and keep on introducing them to real life scenarios, slowly their confidence level will get higher automatically, and they'll be able to perform much more better.
True, sir. Last query, sir.
Yeah.
You had a very good talk or few minutes you dedicated to the hydration part, sir. Uh, a lot of times the athletes do come and tell that how do we come to know that this intake, water intake or hydration is adequate or appropriate?
Dr. Fareen, the need for hydration differs on whether they are exercising or they play in a cold environment or a hot environment, whether they are playing outside or they play inside. What is the body size? Bigger body size sweat more, so they require more hydration. And the for the athletes, what we do is we calculate the sweat rate. So what we do is we in the sweat rate, we take their body weight before running on the treadmill, and then we make them run on the treadmill to their almost their maximum capacity and let them sweat, and then we take their body weight again
Okay.
after some time. So whatever difference you found, suppose the athlete was 60 kg and after running on the treadmill, their weight decreased by, let's say, I'm just giving example, by 59. So whatever loss has happened because of sweat. So what we do is now you divide it by the time. There are formulas, there are regression analysis. So you divide by the time that the person ran on a treadmill. So maybe 15 minutes, 30 minutes, they lost 1 kg. So then there are ways to convert that 1 kg into ounces of water. That means that athlete lost this much ounce of water in this much time. So you can calculate if they are exercising or they are playing, how much approximate water that they are going to leave. They are going to they need to drink again. And the
Right.
best measure is, if you cannot do it, the best measure is to look at the urine color. If it is growing, it should not be completely clear and it should not be completely yellow. If it's completely yellow, the person is dehydrated.
Right. Thank you so much, sir, for joining us today. It was indeed a wonderful talk. Uh,
Thank you.
I would also like to take this opportunity to thank our management, our chairperson, Mrs. Manisha Sangvi, Dr. Parag Sancheti sir, and our principal, Dr. Apurva Shimpi, for providing us with such a wonderful platform. I would also like to take this opportunity to thank our Physio TV team who is working tirelessly to bring such good talks to all of you. And finally, without whom this would not have been possible, our speaker and our viewers. Thank you so much, everyone, for joining us today. Thank you so much, sir, for coming.
Thank you, Dr. Farooq. Thanks a lot.